Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones. Hi, everybody. Welcome back to Raw Remedies. I'm so excited to introduce Dr. Cathy Alinovi for us today. She is a retired veterinarian, now holistic health coach for pets, and she is quickly gaining national recognition for her integrative approach to animal health. After graduating from veterinary school, she quickly realized that conventional medicine did not meet enough of her patients' needs and became certified in animal chiropractic care, veterinary acupuncture, Chinese herbal medicine, and many other effective alternative modalities. In her practice, Dr. Cathy currently treats about 80% of what walks in the door, not with expensive prescriptions, but with adequate nutrition. Healthy PAWsibilities, spelled P-A-W, PAWsibilities, Natural Pet Wellness Center is the place to develop a healthcare program for healthy pets. As well, Dr. Cathy is Executive Director of Next Generation Pet Food Manufacturers Association, which is the only trade association that represents fresh pet food. Her goal, keep fresh food available for all pets and their owners. Dr. Cathy, thank you so much for being here. Welcome.
My pleasure. Thank you. I'm laughing for reading that. Thank you for reading that.
Well, you know what?
It's
I think
true,
it's important.
though.
It's
true.
exactly. It's true. It's true. And we all get to a point where we realize that like conventional care is not enough, right? And so I think that it's such an impressive list of extra things that people don't realize we need to do, right? I come out of medical school, you come out of veterinary school. Those things are not included in conventional programs. They're extra time, extra money.
Oh gosh, no kidding. They're like $5,000 to $6,000 and 250 hours, and yeah, absolutely. Thank goodness for family. I couldn't have done it all. Honestly, I am so grateful, honestly, to family because, people come in, they want me to. Their dog has a torn ACL, and they don't want to do surgery, and they want me to line their dog up and make them walk better. And we have the food talk, and they're looking at me funny. And I'm like, all right.
Like you grew two heads?
Right. Why am I talking to you about food when you brought me your dog for ACL? And they're like, building blocks. Thank you. They get it. It's there. It's there. It's just, you're right. It's so uncommon. Yeah. We don't really talk about it. We don't.
Well, we've kind of forgotten as a society because science and medicine has advanced so much that there's not one pill for everything. There's 10 pills for everything. And it's so easy to just go to your provider or your veterinary professional and say, oh, I have this problem, or my dog or cat has this problem. And they go, oh, well, let me write you this prescription, and bing, bang, boom, symptoms are gone. Pet must be fine. That's not the case. It's just hiding the symptoms, right? We never got to the root cause of the problem, and it always comes back to nutrition.
Right. And often there are side effects, which is interesting. I've been doing some continuing education, and the instructor says they aren't side effects. It's latent, hidden thing going on that we didn't know. The body wasn't expressing it. And so I'm struggling with that because it's like, okay, if the regular vet gave your dog steroids and it didn't make it better, and he's puking, I guess maybe now I need to work on the spleen system. Because we're puking, and it was hiding and it wasn't there, and the medication brought it out, and it's a cold medicine, and so it's crazy what we can do.
It's like you start down one path and all of a sudden you see a little extra fork off to the side and you're like, oh, let me explore that really quick. And then you come to two more forks and you're like, oh gosh, let me explore this one really quick.
Right. If there were 2 or 3 or maybe 4 of me, then I could get all the training done.
It would never be enough. It would never be enough. But
Agreed.
yeah, I like what you said about, so I mean, latent effects, that's actually something interesting to consider. I never have looked at a medication side effect as like I feel like the best example I could give is GERD. So it's so funny. I was just talking to Rita Hogan
Oh,
about
great.
GERD and like applications of herbs and stuff for pets. And one of the issues with GERD or heartburn, or you might hear it called reflux, is, for people, you can't throw a stone in the air without it falling on somebody who's prescribed a Protonix or a Meprazole or some kind of PPI, right, an acid blocker. But the problem with these medications is that over time, it causes you to develop a vitamin B12 deficiency.
Right.
So it would be interesting to think of it like that is a latent like expression of whatever is going on all like naturally that's causing those symptoms, as opposed to maybe just looking at it like, well, the medication that you're on is causing you to develop this deficiency through whatever process.
So look at that example. Boy, there's a lot of use of antacids, whatever category they come from, in animals as well. And it drives me out of my mind because most of the time these animals are low in acid, but because we didn't learn about it in veterinary school, we didn't learn about it in medical school. All we know is that the journals say, well, you should give acids when you give steroids, for example. But if the animal or the human develops a B12 deficiency, to me, that goes back to the body's ability to absorb. Or it also goes back to the body's ability to digest. And so if we now get a side effect on one of the acid reduction chemicals, probably because that patient needs more acid, and by emphasizing the deficiency of acid, now we can't absorb it. And so there's your latent problem. It wasn't screaming obvious that this patient can't digest, can't absorb until you took away the rest of the acid.
Yeah, you were half the problem was showing. You gave a treatment that actually just brought it the rest of the way, and now it presents itself. Yeah.
Yeah.
If only we looked at more medications.
And I don't know, what's your experience with the GERD patients? How many of them are low acid? Because reflux in dogs is they almost always need hiatal hernia correction, which is chiropractic, fix their food, and they need more acid.
So there's this really interesting test that you can do for humans, and I don't know if you could apply it to dogs. I feel like physiologically you could, where if you take 1/4 of a teaspoon of baking soda and you put it in about 4 ounces of water and drink it, and it has to be about 3 hours after a meal. If you drink it on an empty stomach, it will react with the chloride in your stomach acid, and it will cause you to just belch a lot. And so if you have appropriate stomach acid, you'll do a lot of burping. If nothing happens, you don't have enough. So that's a really easy, at-home, completely free method of figuring out if you have hypochlorhydria. Dogs burp. I feel like you could probably do that to them. Not like they would be very happy that they're walking around belching, but...
lots of them burp anyway and are happy to do it in your face.
Yes, they do.
That's an interesting test. I like it, and I need to think about, because we just need to get say how much baking soda? 4 ounces of water.
Fourth of a teaspoon, about 4 ounces of water.
Oh, just a little. You could easily syringe that into a dog, and then I could do the math, and instead of a 150-pound dog, if we have a 30-pound dog, gosh, it really isn't that much. Interesting, the test that I have people do, but I'm getting mixed results, is I simply have them check very first urine pH of the day. And really, I know it's interesting. So they're like, oh, you do that differently. Cool. So first urine pH in my world should be 6.5 to 7, 7 being neutral, just barely acid. And so I'd been going on the assumption that these animals that are alkaline, which we know, those are the kibble eaters, the ones who just aren't making any acid, that they need acid, and that one's easy. But what I'm also finding is that often the ones that have a pH of 5.5, so they are too acid, might also need some digestive enzyme plus or minus the betaine hydrochloride help. But how awesome would it be to just give them some baking soda and watch them be a burp factory?
Maybe I'll give one. Maybe I'll do it to my dogs and myself at the same time as an experiment.
Right. Yeah, it's fast. And, we're not hurting anybody by doing any of this. And the cool thing with adding the betaine hydrochloride, I have people start really small. So if they have this little 10-pound dog, I'm like, okay, I want you to use, if you can get to 1/8 of a tablet, but 1/4 of a tablet. Because apparently the way we humans are supposed to do it, we do 1 with a meal, 2 with the next, 3 with the next, and about 7, tummy gets a little bubbly. So we know, oh, okay, I need 6. And you go backwards.
Yeah.
People are a little bit more protective of their pets than themselves. And so I'm like, okay, start low and barely add any at a time until we get either better pH or better digestion or less burping. Because some of these dogs have nasty breath and it's not their teeth.
Yeah, it's their gut, SIBO.
It's the rotten food sitting in their stomach because there's not enough acid. Absolutely. So maybe some of us people too.
Yes. Yeah, that is true. If you have a halitosis, particularly bad breath, you should be going to see if you are having appropriate gastric emptying, because that food just sitting there rotting away is going to smell, and it comes right back up and blasts you.
And then, and this could be related to taking any one of those acid stopping medications. I've seen, and you listed one of the common side effects, the inability to process vitamin B. But how about depression? Because the acid, it's in the stomach, it's meant to cut this giant piece of protein into little amino acids. The very first amino acid that comes off is tyrosine, and that goes to make dopamine. And so if we can't digest our food, we don't have our natural neurochemicals that help us have a healthy, balanced mental state. I had a cousin who was put on antacids in high school, and the poor thing tried to commit suicide before she graduated. Blame antacids.
Well, and there's so many things, but I mean, honestly, we could go on forever and ever about the inappropriateness of certain medications, but it's just, I think always ascertaining, is there a lifestyle modification that I can do first? Is there a food change that I can do first? And when I say food change, what I mean is, should I actually start feeding food instead of feed?
Oh, you're so weird.
Instead of crap.
Yeah.
I'm not afraid to tell the truth
And
on this
is that
podcast.
even obvious to people, the difference? Okay, medical news today. Stomach acid drugs may cause depression. 5 common drugs that can raise your risk of depression includes antacids, the proton pump inhibitors. So it's hidden. It's there. It might not be listed in the insert, but there is peer-reviewed literature about it.
Yeah. And I'm not surprised to hear it.
Right?
Not surprised at all.
So you want to talk about the difference between food and feed, huh?
Between food and feed, yeah. So when you see somebody come in, or you're, doing a consult for a new dog or cat, and you see right there on their intake form, Purina, whatever, any kind of kibble, any feed grade food. What is your approach? How do you get these pet parents to hear what is so obvious and yet such a barrier?
I am not kind. And I don't do it to be mean. I do it because I learned that if I am tactful, people don't hear me. And they're like, well, she said it was okay. And I'm like, I said it was okay. I didn't say it was good. So I have now gone to where if somebody tells me they're feeding kibble, I've had people tell me, because I set all my appointments up by text because I am my front office. I sometimes my secretarial skills are deficient, but if somebody tells me, and I've had one or two people say, I won't change the food. And I say, I can't help you then. There's no point in making an appointment. If you want to talk about it, and I'm happy to explain to you why. And one time the person actually stopped and thought and went, seriously? I'm like, yeah, seriously, I can't help you if you're going to continue to put poison into your pet's body and you want me to try to make things better. If you're going to come bring your baby in for a chiropractic adjustment, it's not going to hold if you're feeding horrible food. If your baby has liver disease, cancer, kidney disease, pancreatitis, any of those, and you are not willing to feed real food, I can't help you get your baby better. And I do give people the choice, and I'm like, now, my criteria is real food. I don't care how you do it. My goal is to help you do it how it works for you. And I have some people who want to make it themselves, so I help them make balanced diets. I tell people cooked or raw, I don't care. I want real food. And if it's cooked, I do a little bit of help that way. And if it's raw, we do a little bit of help that way. And then I say, if you want to buy it already made, great. If you want to make it yourself, fantastic. And I help them with that. And so then they start to think. And some of them will go, I don't have time to cook. And I'm like, yeah, me neither. Where do you live? Well, then my next question is, where do you live? They tell me where they live. And I'm like, okay, this store, this store, this store is all by you. Shop in the freezer, because that's where the real food is. I don't care. Again, I don't care if it's raw or if it's cooked. It's in the freezer. And then, of course, raw goat milk. It's always in the freezer. And so I'm like, okay, you walk in the door. Some of the stores I've been in, I'm like, you walk in the door, boom, there's the freezer. Stop right there. And if you talk to the owner and say that I sent you, the owner goes, she's really picky. And I go, yeah, I am. But the owner loves it. So that's how I help them. And I figure out how to get them there. Some people come in and they're already making their own food, and I give them 4 gold stars. And then I ask several questions because I do want to make sure that they're getting their balance in there. I want to make sure that we've got the minerals. Often, we need something to add, choline being a B vitamin. So that could be eggs, could be liver. And then I talk about liver. Oh my goodness, there's liver. There's good liver and there's bad liver. And I've gotten so picky about liver because unless it's pasture raised, if it's feedlot liver, so if they don't tell you it's pasture raised, it's feedlot, right?
Right.
There is toxic amount of heavy metals in those livers.
Yep. So much copper. And I mean, everything about a feedlot cow, unfortunately, the degree of inflammation in their body. And
These
it just.
poor animals. I know. Yeah. Cows are so cool. I graduated in vet school. I was going to be a large animal vet because cows are cool. They can lick their nose with their tongue. It's so funny.
So can I.
Hey.
Should I do
Are you going to do it on camera?
I will do it.
Do it. Yes. Oh my gosh, she did it. I love it.
I'm part cow. And, my grandma always tells me I have cow brown eyes.
Oh, I love it. That's awesome.
The hidden talents of holistic pet health coaches.
Right. Absolutely. That's beautiful.
Oh gosh. But we're not giving enough appreciation to the animals that we are raising for food, which, they do us a service because we consume them and we derive nutrients from them. And, aside from the fact that they deserve to be treated humanely and live their best life pastured and eating a species appropriate diet, if you even all that aside, if you don't do that for them and worry about their welfare, all that does is fall back onto you when you consume it, right? You're eating an inflamed animal. You're eating an animal that's high in omega-6s, high in heavy metals, maybe received multiple rounds of antibiotics because they were packed so close and the environment was dirty and they kept getting infections. And now because of that, you have antibiotic resistance. I mean, it's crazy what we
Right.
do to ourselves because of what we do to the food we eat. And that's just the animals. Don't get me started on the plants that are sprayed to high heaven with glyphosate and all kinds of other crap, genetically modified. All right, I'm going off on a tangent.
Yes. But then we feed that to the cattle. If
Mm-hmm.
they're lucky, when I was going through vet school, one of the things that we talked about is how to quickly develop the rumen in cattle. The rumen is that giant first stomach. Most people have heard cattle have 4 stomachs. The rumen is that big vat that sits there on the left side of their body, which is how they get to burp up and chew their cud because it's sitting there being fermented in this huge vat. The fastest way to develop the rumen is to feed a high corn diet to a calf.
That makes me sad.
It's sad. And so we start these little babies, you're right, on an inflammatory diet. So we're feeding them corn, which is not what cows are meant to eat. Cows are on this earth to eat green things growing out of the ground, being grass. And the herbs and all the other stuff. And so, oh my goodness, what if their rumen doesn't develop until they're 9 months old? Well, we're not pounding them into growing rapidly. And so, right. Oh my goodness, we start at a really young age. It's called creep feed. And by the time the calves are a month or 2 old, they're no longer getting milk because usually they don't nurse. Okay, beef nurses their mother. Dairy calves do not. So even though the dairies milk the cows, the milk goes to people food, and the calves get this weird waste product that was once dairy related. And there's soybean oil in it and, dried egg product and things that calves aren't meant to eat. And so, yeah,
Things
they
that
start
no one is meant to eat.
Okay,
Ugh.
thank you.
Yeah,
Right?
well, have you watched the documentary that came out, I think in November, called Fed a Lie? It's all about seed oils.
No, oh gosh, probably would want to puke after I read it. Watch
You
it.
need to
I
watch
mean,
it. You need to
I
watch
was
it.
thinking about, because you triggered in my mind, have you read the Senef? It's a book about glyphosate
Oh
toxicity.
God. So I can be even more terrified of our crops.
Right. I walked around I was just grumpy for a month because Stephanie Seneff, because everything she had in this book talking about the effects of glyphosate, it was all peer-reviewed literature about humans. Except all these things are going on in animals, and it's not even being acknowledged that our pets are going through all these things. So thyroid disease, heart disease, joint replacement, rheumatoid arthritis, all these things, everything that people get, animals are getting, and she's able to link it all to using the inappropriate use of glyphosate. And now look at your conventional kibble and everything that a feedlot cow is eating. It's all poisoned with Roundup.
Yep. All of the things that are most heavily sprayed with glyphosate, corn, soy, potatoes, all of that. And it all just goes right into and then they bake it to high heaven and they oxidize it and they denature it. And then, yeah.
Oh, but it's okay because then they spray all the vitamins and minerals back on it.
Right. Yes. And it's tasty because we add those flavorings back and we spray it with chicken fat. Who doesn't love oxidized, liquidized chicken fat?
Nothing better than rancid chicken fat. It makes me pucker my tongue.
Oh my gosh.
Oh gosh, for anybody who's about to have dinner, I'm sorry.
I know. I hope no one's listening to this while they're preparing their dinner. And if you are, I hope you bought organic vegetables.
Right. Oh my goodness. And okay, and I was about to say, well, what about using a good oil? But you do know that even olive oil in the United States is not pure olive oil, even though it tells you it's 100% olive oil.
Yeah, it can be mixed with other oils and it can have contamination, even plastics, like contaminated with plastics, microplastics. It's not great. I exclusively use avocado oil if I'm going to use an oil, or I'll use ghee, coconut. So cocoa therapy. I don't know if you know those amazing ladies. They have a cocoa ghee.
Yeah.
I'm obsessed with it. It
Are
tastes
you?
delicious. You can cook
Okay.
everything in it. It's my favorite for my mushrooms. So I'll use
Okay.
that, or I'll use tallow.
Okay. I'm a
Yeah.
butter ghee girl.
Mm,
Butter makes the world
it's
go
just
round.
so good. I have like 1 teaspoon left of the cocoa ghee and I'm crushed. And I'll be seeing them in May at Dr. Judy's Naturally Healthy Pets Conference. And
That's
I'm
too
like
long.
debating, I don't think I can go 4 months without more. I think I'll have to just order it.
I think you will. That's
Oh
awesome.
gosh.
That's awesome. See, we're not only bad news, we are good news people
Yeah,
also.
more good news.
Good
Go check out
foods.
Cocoa Therapy. They have great products.
They do.
So, okay, so question for you then.
Okay.
A huge focus on nutrition, right? It's everything. It starts with a diet. That's your foundation. Those are one of your pillars. But food is expensive. So I would love to feed all pastured chicken, grass-fed and finished ruminants, all organic vegetables, only wild-caught, sustainably harvested fish, right? But I also need to pay my mortgage. So if you had to choose one category that you feel is particularly important if you had to put your money somewhere in one of these food ingredient categories, is there any one that you feel is the most important to get the utmost quality?
Oh, I have people ask me that a lot. Um, and I tell them do their best. Even if you buy regular conventional grocery store vegetables, fruit, meats, eggs, all of that, it's light years better than what's in the kibble.
Mm-hmm. I agree.
So,
I totally agree.
and it's not until I have had worked with some animals that we've really worked to get the Roundup out of these animals' bodies. Usually I can get it out in a couple of weeks with a good goat milk cleanser. I've got some nice herbs from Supreme Nutrition products that help detoxify it. Um, every now and then I have to get really picky about the quality of the food. I'm very fortunate with my clients. Some of my clients can't afford the pasture-raised meat for the entire family, including the animals, and only buy organic vegetables, and it's beautiful. And I have some people who can't, and they're like, I shop at Aldi, and I say, it's fine. You are
Yep.
doing better than buying kibble. You do the best you can. So, yes, it's not perfect, but if we can get them, because I thought you were going to ask me well, I can't afford not to feed kibble. I'm like, okay, I hear you. How much money do you spend at the vet every year? I want people to
Yep.
spend money on food. And I was like, look, do you want to keep coming to see me? And they go, no offense, doc. No. And I'm like, I'm not offended. I don't want you to
Yeah.
come to me for something that you could fix through diet. Yes, I want to line your dog's body up because he thinks he's a battering ram and he drives his head into the fence. And so let me line up his neck and line up his back end. But the adjustment will last longer if you're feeding him real food and not feeding him crap in a bag. So, yes, do the best you can.
Yeah. I'm a big fan. So I definitely cannot afford, for even for myself, like for myself and my husband, the one place where I draw the line is I will only buy air chilled chicken
Okay.
because anything that's not air chilled is dipped in like a Clorox water. It's just disgusting. So for myself, but I don't really feed the dogs chicken. So they mostly are, like turkey, duck, beef, pork. But I have 3 big dogs,
Right.
and my budget for them is a cap of $400 a month. And
Okay.
so when I'm buying, 70 pounds of meat a month, I can't afford for it all to be pasture raised
Right.
and grass fed. So where I put my money is organic vegetables and pasture raised eggs. I think if you're going to give
Beautiful.
eggs, that's where I try and do. I'll do pasture raised, of course, right now. Kathy,
Well,
you're
yeah,
gonna
there
Dr.
are
Kathy,
those
you're gonna
eggs,
kill me.
aren't
Would
there?
would you like to hear what I did yesterday?
Oh, tell me.
I I'm so ashamed.
Troublemaker, what'd you
I
do?
went to the store.
Okay.
I got a 24 2 dozen eggs, and I put them in my front seat, and then I put the rest of the bags, the actual bags, in the trunk. got home,
Okay.
took the
Okay.
bags out, forgot about my eggs.
Okay.
I left them in the car
Okay.
for like 36 hours.
It's okay. It's okay.
It was like the last pack on the shelf because I
I-
can't find eggs
Oh,
anywhere.
they're probably okay. I don't know. We get into certain habits in the United States. Um, I, I, I think well, okay, I'm trying to justify that I like to travel. I like to travel and I like to shop locally. And so,
Mhm.
when you go into a grocery store in Mexico, the eggs are not refrigerated,
Mhm. They're
period.
not washed probably, right? They don't wash
They're
that like
clean.
protective layer.
They're
Do they?
clean.
Oh,
Yeah,
okay.
they don't have poop on them like when I get them from a local farm.
Yeah.
Um, but they just sit out on the shelf and you want to know it's really weird. Like if you go into the grocery store and just in front of the butcher section, they've got an cooler that's open and it's freezing from the bottom and it's got all these packages of wrapped meats, whatever.
Yeah.
In Mexico, they have about 150 chicken leg and thighs sitting there in that open container. You just reach your little tongs in and you pick out how many you want and you stick them in the bag.
Okay. All right. I mean, hey, don't get me wrong. I put the eggs in the fridge. I gave them a
Your eggs are
sniff because I
fine.
was paranoid, but
Your eggs are
I could have
fine.
kicked myself because you can't find anything now because, well, we all know
Right.
why, but
You're fortunate because it's a cooler time of year and most of us are actually pretty cold right now. And even if it was in the 50s and 60s, they're fine. If it were the middle of summer and you were sitting down here in Florida, it was 110 degrees, I'd be like, you just wasted 2 dozen eggs. So
yes,
a lot of
luckily the
us,
highest we got yesterday was like 60, but it's down to like
oh, you're
35 at night.
fine. They
So,
were refrigerated on the front seat. They're just fine. Fortunately, I'm with you.
phew.
It's gold. They're gold right now.
I know I could probably sell them for twice what I bought. No, I'm kidding. But yeah, no, they are. And when I do my meal prep, each dog gets an egg per day,
Okay.
which means I need, let's see, 30 times 3 is 90 eggs for just my dogs for the month.
Right.
So I don't think I'm going to be able to find that when I do my meal prep next week. So I'm just trying to, each time I go to the store, if there's a couple dozen, I'm like, oh, better grab them. Oh, better
There
grab
you
them because now
Right.
normally I go in one fell swoop and I just grab everything I need in bulk, but that's not going to work this time.
Yeah. The weather will warm up and we'll move out of flu season. And oh my goodness, I've talked to bunches of humans who are sick with the flu. It's absolutely flu season. It's not just the poor bird or the
Yeah.
pigs, the cows,
Yeah.
or
Yeah.
it's all of
Everyone has
them.
the flu. Everyone has RSV.
Hmm.
It's just virus season. That's just
Hmm.
what it is. And even the hospitals, this is the time of, I don't like this, but this is the time of year that you have the mask mandate at hospitals, right? So if you don't get your I even hesitate to say the word now because I feel like everything's being censored these days, but if you don't get your flu shot, um you have to wear a mask until flu season is deemed over, which is usually March
Okay.
1st. So I'm in a mask for at least another 6 weeks.
That's well, at least they give you the option
Yeah, that's
in
true.
spite of it's where do you know what ended up being the scientific thought about whether or not masks really work? There's an awful lot of opinions, and I've read articles going both ways. And at the very least, it's at least perception.
Yeah.
Yeah.
Hey, if
And
you feel safe mentally, no.
right, right. And
I
yeah,
think there's
and
a lot of factors that go into everything when it comes to health, right? And in the end, it just comes down to the individual and what is your health status? Do you have, are you immunocompromised? Do you have an
right,
autoimmune disease?
right. Are you eating
Do you have cancer? Are
inflammatory
you
foods
actively
and it's
getting
pissing off
chemo?
your guts? And right.
Yeah. Yeah.
Yeah.
So, so anytime you want to be, if you want to be healthy and protect yourself, the best thing that you can do is make sure you're giving yourself an anti-inflammatory species appropriate diet that's not, full of toxins and chemicals, clean up
Mhm.
your environment. And, it all starts with lifestyle changes that you
Yep.
can do yourself.
You
Even
can.
if it's one single step, right? Let's say you live in the city. Well, if you live in the city, maybe you're exposed to a little bit more noxious fumes, right? Maybe there's more gasoline than if you were in the country. Okay, fine. But what can you do within your own little square cube of a home or an apartment? You can get rid of fragrances like wall plugs. You can get rid of chemical cleaners and, make your own with vinegar and essential oils, right? There's all kinds of things that you can do to decrease the amount of toxins you're exposed to in your environment, and you just do the best that you can with your foods.
And change your air filter and ask your family for a room air filter for your birthday or Christmas. Absolutely. Lots of things that you can do to reduce. And it's good for your pets too.
I saw this really cool video one time. Someone must have sent it to me where somebody made their own kind of filter by taking, like the big square filters that you like slide into your heater or whatever. They taped it to the back of a box fan, and they were like using that to help circulate air in the room, and like even that to just kind of pull some particles out. I mean, it's not the most ideal, but you could even DIY something that's helpful.
Oh, that's beautiful, because they'll pick up large particles with that. I could use if my blinds needed a new home or if they were broken, I could absolutely repurpose them. And they'd pick up hair and large particles. Genius.
So, and Lord knows there's enough hair in my house with 6 pets.
Right. I know every time I clean the floor, I go, how did we get this much fur? It hasn't been that long since I've cleaned. And
oh, boy. So, all right. So speaking of toxins, let's talk a little bit more about the things that by they, I mean, like, big food, like we have big pharma, right? Are sneaking into our, I'm going to put this in air quotations, but sneaking into our food right under our noses on the labels. Can you talk to us about how to effectively read labels?
Oh, gosh, you can't. They're all lies. Honestly, things are given names to protect the reusers, the renderers. Dried egg product sounds fine, but dried egg product will be what would have happened if it were the dead of summer and your eggs sat there on your front seat for 36 hours and they were cracked and they rotted. That would go to dried egg product. Powdered cellulose. It's very common in the conventional canned foods, and it's even in the kibble. It's sawdust.
Sawdust.
And it's sawdust. It's waste dust from a mill. It's the stuff off the floor. It's not the clean. You said with the chicken fat, I love chicken skin. My daughter and I have a competition for who's going to eat the skin off the chicken first. And she gets one side, I get the other. And that chicken doesn't have any crunchy skin left, even though there might be meat left for the meal tomorrow. But that is not what's going on conventional pet food. What's going on pet food is what you said, oxidized, which is a fancy word for rancid, inflammatory, tastes bad, gives you a taste in your mouth after you eat it. It's inflammatory. It causes cancer. Oh, I know. Carrageenan, number 8 ingredient in fresh. It causes cancer. That tube that looks an awful lot like bologna in the refrigerator section at certain stores.
Disgusting. I hate that they're even allowed to have the name that they have.
They were genius, honestly.
They were
very smart marketing. But then I have people who say, well, I researched it and it doesn't have any meal in it. I'm like, I hear you. But it's all a lie. None of these places, these places, let me be specific instead of being generally beating on things. Conventional kibble factories have zero refrigeration. I don't care if they tell you it's a meal or not. There's zero refrigeration. So that so-called meat ingredient arrives as a powder or a slurry or something. it doesn't need refrigeration. The only places that use refrigeration are the places that are using real food. So cooked, raw, the pasteurized, like the HPP foods,
Yeah,
the
human grade
right, human
facilities
grade,
and
but
yeah.
even human grade is difficult because the way that human grade is written, if I use every single ingredient that you and I would eat, but I'm not made in a human in a human food factory, I cannot call it human grade. I cannot say human grade ingredients because it's made, so it might be completely 100% absolutely perfectly acceptable, but it's not made in a human food facility. I cannot call it human grade. So it's really hard to figure it out, but you can't sort of tell on the ingredient list. But even some of the human grade foods have 75, all right, I'm exaggerating again, 24 vitamins and minerals added to them. And they're added out of fear, question that we're not going to meet AFCO standards. There's nothing wrong with AFCO standards if you're making kibble, because that's absolutely what AFCO standards are for. AFCO standards are made, AFCO, American Association of Feed Control Officials. Everybody looks on the bag of food, meets AFCO standards. Well, that's because AFCO told the vets to tell the consumer that they need to be looking for that on the label. All it means is that your kibble has enough vitamins and minerals that your dog won't die in 6 months, or your cat.
And what I hate
That's all
about
it
it
means.
too, though, is like the AFCO feeding trials are such a joke. They're
They're
terrible.
beautiful. Think of it, but turn the coin over. Think of it the other way. Because if I want to be able to say AFCO complete, Kara, when's the last time you 100% complete? You probably do. You're probably the wrong person to ask. When's the last time you 100% complete and balanced your own diet?
It's impossible because
Thank
even if
you.
you work it all out on a spreadsheet and that spreadsheet that you printed off because you used a diet formulator told you, there is no way for you to know if the piece of meat that you selected off the shelf actually meets that
No.
median nutrient profile that the USDA Department of Agriculture says that it does. So unless I tested everything I ate, I can't prove it anyways.
Okay, but you also didn't sit down with the spreadsheet and pencil it out,
No.
did you? Right.
Yeah.
And we haven't died yet. And so
No.
you and I are I'm doing the Cathy Alinovi feeding trial every day. And if I don't feel good, I need to fix something in my food. And even though I ate gluten-free pizza last week, I can't do garbanzo crust. That just does not agree with me. I did my own feeding trial.
Yep.
But the cauliflower crust ones, those work as long as there's no potato starch in it. So the feeding trial's not all bad. It gives us options, but I would agree it's a joke. You start with 8 dogs, and if 6 are still alive in 6 months, and 6 blood numbers come out good, fantastic.
Yep.
So,
Well,
I know.
I'm just waiting for a huge feeding trial to come out of fresh fed dogs. I'm waiting for it. I know things are coming.
There are small companies who are doing their own. So yes, when you read my outrageously long bio and I switched from being a natural vet to being some executive director weirdness with some trade association, what the heck is that? Several of the manufacturers who are members of Next Gen, the trade association, have done feeding trials. And all right, so it starts out with 6 dogs or 8 dogs, finish with 6, but now you have 10 manufacturers. Boom, you got a meta-analysis. Now you have actually some scientific rigor in there, and we get a good epidemiologic study. It's coming. We have data.
And for those who don't know what a meta-analysis is, it's where you take multiple studies on the same topic, you put it all together, and you compare the data. So it just gives you more power, essentially,
Yes.
instead of saying, well, there's one study where they did this one thing, and this was the conclusion, so this must work for everyone. Well, you can't say that. You need more than one study. So That's what a meta-analysis is.
Thank you. Yes, it's statistics geekiness. But yeah,
My
so
least favorite class.
Oh, I loved it. Math girl. Yeah, so it's coming. In fact, that's a really good idea. I think I need to talk to these people and put the information together. It's hard enough to get it published.
Yeah.
Most of the manufacturers are having a hard time to get the peer-reviewed journals to publish it because who funds
God
the
forbid,
journal?
right? God
Right.
forbid. Well, it's funny. It takes so many years for change. And I was listening to a Dr. Elizabeth Wall's lecture last year, and she's a functional medicine doctor. And what sparked her functional medicine journey was that in her, I think, late 20s or early 30s, she was diagnosed with rapidly progressing multiple sclerosis.
Oh,
And
wow.
for people who don't know, multiple sclerosis or MS is a debilitating neurodegenerative disorder that essentially eventually leaves you completely paralyzed. It's terrifying. And all of the conventional methods didn't work for her, and she continued to get worse. She was bedbound within a year, and the doctors all told her, I'm sorry, there's nothing we can do. And she refused to accept that, completely changed her lifestyle, completely changed her diet, worked on her microbiome. She actually, all of the other doctors that were lecturing for this module, which was all about the GI system, they all joked that she's known as like the sauerkraut queen because she has so many servings of fermented foods daily, and she makes her own sauerkraut and she shares the recipe with everyone. But within a year of doing that, she was riding her bicycle again.
Beautiful.
And when she tried to publish her data, they refused to let her publish it, and she was let go from her teaching position. And it wasn't until 12 years later that she was able to make that into a journal. And now she's teaching it. So it takes time, which stinks.
Right.
Time and patience, but eventually the data speaks for itself.
Good for her, for the patience, the persistence. Yeah. Wow.
Yeah. I was so
the
impressed.
System doesn't
she had
want
me
to
in tears.
acknowledge that.
Yeah.
There's
just proves
money and ill health.
Yes, you are so right. And everything, almost every medical condition that exists out there, especially autoimmune diseases, can be improved with diet. I will say that. I will die on that hill. It doesn't have to be immunomodulators. It doesn't have to be steroids for life. Look to the diet and you will improve your autoimmune disease because it comes from gut dysfunction. Right. And no one talks about this.
Oh.
Unless you're in the space. We talk about it.
There's a lot more money to sell. The heavy duty chemotherapeutics, not even, Pred is so cheap these days that that's also like given out. It is given out like candy, but yeah. Absolutely. And it's like your example with Elizabeth Walls. Took her a year to get better, 12 years to get published. That's patience. People want an instant fix. It's all the way back to what we said at the beginning. There's a pill for that. Sure, there is. And they don't always work.
Yeah. There's 1, there's 10. But it's not actually making you better. It's just making you think you're better because your symptoms are gone. Just wait. As soon as you stop, it's going to be an explosion that was bubbling beneath the surface. It's like the Mount Vesuvius of diseases if all you do is cover it up. It's just going to be cataclysmic.
Yeah, and it's funny because neither of us want to see that for people or their pets. That happens all the time.
And that's why they come find us. It's like it's the kind of the last resort while everything else, conventional medicine failed me. That's how I got here. My dog with pancreatitis, conventional medicine failed him. And I found my way here. And, I think it's just very similar for so many people who end up in this space. They use fresh food and holistic practices to really work on themselves or their pets. They see it work and they go, I have to share this with other people. I have to help other people. I need to tell the world. And they become, leaders in the industry. So thank you for being one.
Oh, you too. Golly, I was so excited when we were introduced by Angela. I was like, oh my goodness, And see, you've got all the books in the background there that I have hiding in my closet. It's like,
I know. Yeah, there's so many.
I love books.
Yep. And I have over here, we have Connor's book,
Okay.
Feeding Dog.
Very
Yep.
nice.
Love him. And Rita's book is coming out on, I think, February 4th, The Herbal Dog. I can't wait for that one. And then you know what just came in the mail? And this isn't about pets, but it's called Good Energy. It was written by Casey and Callie Means. She's an ENT surgeon. It's all about metabolic health. And I'm so excited to read it. So excited.
I don't know when you have time, girlfriend.
I know, right? Never. The answer is never. But
I know.
Oh,
Oh, fantastic. I'm glad to hear that you've got their book. I've listened to several webinars, seminars with the Means, and mind blowing.
I listened to them speak on Dr. Mark Hyman's podcast a couple of weeks ago, and I was first introduced to Casey. It was someone else's podcast, but I heard her speak, and it really resonated with me because she became so disillusioned with conventional medicine because of her mom became ill, and her mother, unfortunately, I don't want to say like the victim, but just like another conclusion of the kind of Western approach to medicine. High blood pressure, here's a high blood pressure pill. High cholesterol, here's a high cholesterol pill. High blood sugar, here's a diabetes pill, right? And then one day, bam, cancer. And if there's anything that I can say, the amount of suffering that we allow to occur in the human healthcare space,
crazy.
I feel very strongly about people being allowed to die with compassion and dignity. And we don't do a lot of that. Instead, we walk in and we go, well, you're on 15 medications and your kidneys and your liver and your heart aren't working very well, but you have cancer and we could offer you this chemo and this surgery. And there's a 15% chance that maybe you could live for 3 more months. And it just makes me wonder, you know, if the conversation instead were more geared toward, what do you value? What is important to you? Do you value spending time with your family?
Beautiful.
Do you value being able to read books and communicate and take your dog for a walk, right? If these are the things that you value, you may have 1 more month to do them if we do nothing. And then you may pass away, or you may have 1 more day to do them, and then we could do the surgery, and then you might sit in the hospital for 6 more months until you die. You know, so it's really hard. It's very difficult because no one can predict what's actually going to happen to you.
No.
There's just no way to know. I could trip on my way out the door after this podcast and, you know, hit my head and exsanguinate, and that'll be the end of me. You know, there's no way to know. You know, but because I work in healthcare, I know what I value, and I think I know what I would want if I were put into that situation. And I just have communicated that with the people who would be my decision makers if anything ever happened to me. And the reason why is because I don't really trust conventional medicine practitioners to have that conversation with me at the end. You know, at that point.
I don't know firsthand. Aren't they not really allowed? Depends on where they work.
It depends on where you work. It depends on what department makes the hospital profit. And it depends on just the culture of where you're working and how good people are at talking about that. So yeah, there's a lot of factors that play in there, and whether or not someone's had the training, right? You can't just walk into a room and say, hey, you're going to die. Like, do you want surgery, or like, what do you want? You know, like, you can't do that. You have to have a compassionate approach. You have to
absolutely.
You have to listen.
There's a way to do it. You're right. I have people ask me all the time. Often, and maybe this is where we actually give animals a little bit more dignity, because often I'm meeting people when they have a cancer diagnosis in their pet, and their owner goes, oh, well, I never thought about it before, but maybe I need to think about alternative medicine. And I give them a whole lot of options to consider. And then, but they often say, well, how do I know? And so, depending on what the animal looks like, because sometimes the animals come in and I'm like, oh, this poor baby. And sometimes the animals come in and they're still feeling pretty good. I'm like, what's his favorite thing to do? and oh, sleep. And I'm like, oh, stop it. Not right now, because he's on gabapentin and he can do nothing but sleep. But 6 months ago, when we felt good, what was our favorite thing to do? Go for a walk. Okay. When he doesn't want to go for a walk anymore, and there's nothing that you can do to get that desire for a walk back, then it's time to think about quality of life. It's favorite thing to do. When I'm not complaining about conventional pet food, let me out of my misery. It's well, maybe it's not my favorite thing to do. It might be my second favorite thing to do. But in dogs and cats, they're like this, and really any animal. And honestly, I think it's what you just said about people, but we're not really allowed to. If I can't do what I love to do, why would I want to be here? Don't stick me in a hospital bed. Put me in the woods and let me go wander off like a cat, and don't worry about it. Bye-bye.
Dr. Cathy, that is exactly what my grandmother used to say. She did pass away 2 years ago now, and she went exactly the way she would have wanted, and I'm very glad for that. Yep. Quickly, painlessly, and surrounded by family. But she used to joke that one day, if she got sick enough or she ever developed dementia, she said, "Promise she'll take me to Yellowstone and let me wander off so the wolves can eat me."
I agree with you, Grandma.
That's what she used to say.
Absolutely. Go, Grandma. Good for her.
She was a spicy lady. That's who I get it from.
Excellent.
Oh my gosh. I don't know how we got off on this tangent, but I think the point here is I felt very connected to Casey because of the way she told her story, and how, what happened with her mom really resonated with her and made her realize that there are a lot of disparities in the conventional Western human medicine paradigm, and that there is a better approach. And she walked away. She walked away from everything she knew, everything she worked for.
At the very end of her residency.
Yep. All that money, all that time. I mean, can you imagine 12 years of your life? It's almost like you hustled and bustled, and then what? And how scary. And that's kind of how I feel
are
now.
Just exemplary. Yeah.
It's good beautiful for her, and I strive to hopefully be able to tell that same story soon. I'm almost done with my functional medicine training. Two more classes.
Good. You're there.
I'm almost there. But all right. So, Dr. Cathy, how can people find you? Because somehow it's already been 59 minutes. I don't know how this happened.
Healthypawsibilities.com, and it's spelled with a paw, Paw. I've got a free report, kind of get people introduced to how I think about things. And it says how you're over vaccinating your pet and overpaying your vet. And then I've got monthly membership because I have people all over the world, honestly, who reach out and want to know, how do we make things better? And phone consults. And then Tampa Bay, come see me. There's all kinds of ways to get a hold of me.
Great. And you have a blog, and then what about the next gen pet food?
Next Generation Pet Food Manufacturers Association. It's a long word. It is a trade association that I started. I started it in 2016. I relinquished my veterinary license in 2016. I had 17 pages of charges of fraud, animal abuse, and negligence. I couldn't sign them. So I said, take my license. And I did start the trade association then, because I knew that fresh pet food was still absolutely critical to everything that I believed in. And part of why I got all those great charges was because I was like bucking the system, and we don't need to be giving full dose rabies vaccine to 16-year-old chihuahuas and that. But so my goal is to make sure that we always have fresh food available for our pets, so that the manufacturers have somebody to represent them. And so I, twice a year, stab my eye out with a really blunt pen and go to the AFCO meetings and represent the fresh food manufacturers. But that's the great thing about the Next Gen website, and it's just the initials, ngpfma.org. On the About Us page, it lists some of our manufacturers, not all of them. And understandably, some of our manufacturers are like, okay,
Yeah.
that's fine. Because
It's scary.
it is scary. And so
you don't want to be persecuted and you don't want to be singled out. But, I'm glad to hear that you were met with adversity and they tried to silence you. And instead of shutting up, you screamed louder.
That's right.
So
yeah, that's right.
That's right. That's what I'm doing here with this podcast. Meta shut down my profile. So what did I do? I'm making my own thing and I'm screaming louder.
Good for you. See, you were saying it right if they shut you down. Yeah, you were.
Exactly.
Beautiful.
Exactly. Oh my gosh. All right. Well, I will link all of Dr. Cathy's socials and websites in the show notes. And it was such a pleasure to talk to you. And thank you for letting me go on more than one tangent there.
Oh my goodness.
That's
what fun. Makes it fun. Hopefully it's fun for the listener. No, great topics. Absolutely. Thank you.
They're all sitting there going, that Kara girl is cuckoo pants.
You and me both, girl.
All the best ones are.
That's right.
Oh gosh. All right. Thank you, Dr. Cathy, and I will see everybody next week. Thank you for listening. Please remember that you, yes, you, are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.